part 2 of my fentanyl patch. I have the best doctors and nurse practitioners working with me. I'm a RN. I don't diagnose. I can't write prescriptions. I could make suggestions. I report on a patient's status, but they're the best. So as I was talking about my fentanyl patch situation, I am not wrong. Fever could increase the absorption of the fentanyl. So I was talking to my doctor about that. Scenario 1, scenario 2, scenario 3. I pick her brain, and she's happy to talk to me about it. So I will pass it on to you. Okay, so I don't want everyone to get nervous about putting a fentanyl transdermal patch on their loved one. It's used often and it's very effective. There's a few things to consider. So let's say if a patient was not in the dying phase and just was using as needed medications more often, we might want to consider a fentanyl transdermal patch. If the next day you noticed your person was very lethargic and maybe decreased respirations, because remember, opiates are respiratory depressants. They will decrease your respirations. If you notice that, that's a red flag. If your person is declining and is kind of entering into that dying phase, you will see your person sleeping anyway. If your person has a fever could make them very lethargic as well. So it doesn't necessarily have to be increased absorption of the fentanyl patch. I know I'm probably confusing some people, but I wanted to put that disclaimer that fever will increase the absorption of a fentanyl patch, and that could be serious. It could, but again, dying, you will be sleeping more. Fever will make you lethargic. If you see those two things, plus a decrease in respirations, it's something to consider. That's why it is so important to keep your hospice team abreast and then in the know of any new symptoms or questions that you have. We are available to you 24/7. The more you know.